Coincidentally, my first startup I was just mentioning, blockchain on AI, was for clinical trials data. So this also predates the current huge influx. And no one used generative AI. We said semi-supervised, machine learning, federated model. So what we did, we had AI go and learn separately for multiple data sets without the data sets leaving the researchers because of all the regulatory constraints, and then come up with hypotheses or opportunities for new drug uses or new drug capabilities. So here as well, there's a new hypothesis based from data from multiple data sources. Who owns this? And this is why we ended up introducing blockchain, so we can trace back the data points from different researchers that contributed to the finding. And that's how we would then be able to split back and tell who owns rights in the finding and who owns rights in a way that isn't political, that can be quantified. Because it's a massive challenge in the medical field. If you discover a new way of using a drug, just because someone's data has been used doesn't mean the weight of the value is the same as someone else's data. So that was the solution we had. But I think in medical fields, LLMs are not really as used. It's a lot more small large models, which is a whole different field. And there you have a lot more understanding exactly what copyrighted data you've used, and then you can work off that and get licensing for what you've created. And you can't do this with large language models, really. It's an insane amount of data. No one knows what really created the model.